let's take a look at the 5 most common sexual problems men face in the bedroom. And today I'll be giving you all of the solutions. In fact, if you've not watched any of my videos before, don't worry. This video gives you everything you need, and taken from my wealth of knowledge and experience working with men over the past 10 years to overcome their sexual problems, I'm going to show you what works. And if you stick with me to the end of this video, I'm going to share with you a 30-day program, free 30-day program that you can use to overcome all of your sexual problems in 30 days. Number 1, erectile dysfunction. This is weak erection, and the problem here is very simple. It is the problem of hardness, where you find it difficult to achieve a good erection, or if you achieve the erection, you lose the erection. And when it comes to fixing erectile dysfunction, very important is sleep. Why? Because testosterone is produced during sleep. If your sleep is poor, it will definitely show up in your poor erection, affecting your on-demand erection, your spontaneous erection, your morning erection, and your night erection. And so try as much as possible to sleep longer and better. Sleep 7 hours at least every single night, and sleep better. Try to get a room that is dark, very, very dark, that even if you open your eyes, you find it difficult to see anything. That is cool. It should be slightly cold and with no noise and distraction. This is very important because of the quality of sleep. And avoid anything that will make you wake up several times in the night to urinate, because this affects the sleep cycle and the quality of sleep. In fact, if you fix your sleep, if you sleep longer and better, you start seeing improvement in your erections. And stress is very important too, because stress kills sex. If you are stressed, having physical and mental stress, it will raise cortisol. Cortisol will bring down testosterone, and this will affect your erection. So whatever it takes for you to feel less stress and manage stress, do that. Do what makes you happy, do what makes you laugh more and relax more. And cut down processed foods and added sugars, because these things affect your hormones and the chemicals. So anything that is processed, that came from the factory, try to reduce it as much as possible and stay with your natural foods. Eat a lot of proteins. We are talking about eggs, meat. Stay hydrated. Always drink enough water so that your urine is clear or slightly yellow and no strong smell or odor. And eat healthy fats. Fruits like avocado, pears, watermelon are very powerful. Beetroot, look for it. Vegetables are good. Cabbage, onions, garlic, spices, whatever it takes for you to eat, stay on the natural sides of food, please do so. And when you see your nutrition is not adequate, consider taking supplements. And 3 of the ones I recommend are magnesium, vitamin D3 plus K2, and zinc. For magnesium, you could go for magnesium glycinate and then go for zinc citrate. If you cannot get all 3, get at least magnesium glycinate and take once just before you sleep. It will help with your sleep and help with stress, eventually helping with your testosterone. But again, try to eat better and get some of these things from foods. Foods rich in magnesium are green leafy vegetables, and if you eat healthy and stay on the natural side of foods, you might not need to buy any supplements. And be careful with stimulants. Smoking damages the blood vessels and affects your erection. Even staying beside someone who smokes, and if you do that regularly, you are a passive smoker, a second-hand smoker, and it affects your erection. So try to reduce that. And even alcohol too messes up with your hormones and your erections. Cut down alcohol, especially beer. And lift weights. Strength training, resistance training, very important. Pull-ups, planks, squats, lift heavy weights. All of these stimulate testosterone production and also burn body fat, which is also a major cause of erectile problems. And if at any point you need some medical or pharmacological support, you could consider things like Viagra or sildenafil. Take them just once in a while just to get back your confidence. Don't rely on them. Even though there's a protocol where you can take a low dose of Tadalase, low dose, like talking about 2.5 milligrams or 5 milligrams or less daily for an extended period of time to reboot your system, you can do that and eventually stop and continue living and eating healthy. To bring back your confidence and deal with performance anxiety, you could consider that. Number 2, premature ejaculation. The problem here is simple. You find it difficult to last long in bed. You find it difficult to last as long as you want or as long as your partner wants. The time is not important. If that is 5 minutes for you, that's premature ejaculation. If it is 1 minute or 2 minutes for you, that's premature ejaculation. So maybe your joystick is oversensitive, or you have poor control. You get carried away, and the solution here is you have to train yourself. When having sexual intercourse, there's a point of no return, and after that point, there's nothing you can do. You must release. So try to avoid getting to that point of no return. So when you're having intercourse and you're getting close to that point of no return, and you will know that from experience, you stop, right? Allow the feelings to calm down, and then you start again. This start and stop method can help you last longer. And there are several other things you can do, like changing your style intermittently, doing something different intermittently. Don't get too carried away. Don't be lost in the feelings and the pleasure. Train yourself. Get distracted. Think about something else. Just don't get carried away. And Kegel exercise is very important, where you stimulate the muscles around the anus and around your groin, around your joystick down there, those muscles around there, where you contract and relax them, doing that several times in a day for an extended period of time can train the muscles there to control both erection and also your ejaculation, helping you to gain better erection and to last longer in bed. And so, there's this squeeze you do when you're trying to hold the fat from coming out, or you imagine you are urinating and you want to stop urine from flowing out. There's this squeeze you do there. That's the basis of Kegel exercise. Don't do it while urinating, but just imagine. That squeeze down there is what you keep doing. Contract, relax to make the muscles there well toned, not too tight and not too loose. This will help with your ejaculation and your erection. If oversensitivity is your problem, consider using condoms, because it will reduce your sensitivity and make you last longer. And there are several things you can use, like wipes, sprays, and creams you can rub to desensitize your joystick and help you to last longer in bed. Then pharmacologically, medically, there are certain pills that you can take under the supervision of a medical doctor that you can take to help you last. But I strongly discourage that. You can stick at most with sprays and wipes that you can just rub a few minutes before intercourse. Number 3 is low libido, low sex drive, low desire for sex. So this is where you really don't respond to your partner, or you can go for weeks or even months without actively desiring sex. Or even if your partner touches you, you don't respond that much because you don't want it that much. And this is not normal, because healthy libido, desire for sex, is normal and it's a sign of health. It means there's something wrong somewhere. And there are several things that could cause low libido. Top on the list is low testosterone, which is the engine, the chemical that drives men and drives desire. Also, stress can cause this. Maybe you have financial problems or marital problems or life issues can affect your desire for sex. For this, I won't say much for this because it's strongly related to erectile dysfunction. All the solutions I mentioned for erectile dysfunction will also help to boost your testosterone and help with your low libido. But first, I would advise you go to the lab or see a medical doctor and ask that you want to check your testosterone. So there are several tests you have to do, but if you are checking your testosterone, make sure you check your total and your free testosterone. Check both of them and make sure that they are within normal range or at least slightly higher, because sometimes you might have normal results but you're still having problems in the other room. And so just make sure that everything is okay. There are other tests you can do, like estradiol, SHBG, prolactin, and so on. Check this, check your blood sugar, check your blood pressure. If they are not normal, there are ways you can improve all of these. You can do everything we mentioned so far for erectile dysfunction and premature ejaculation. This will help with your low libido. But very importantly, again, sleep longer, eat cleaner, no more natural, cut down sugar and other stuff, and expose yourself to sunlight, right? Let's say 15 minutes of exposure to direct sunlight on your skin. This will boost your vitamin D and help with your testosterone and your desire. And fix stress, fix your relationship problems and all those stuff, and look for ways to bring in variety, to inject variety into your relationship and your love life. And if all is said and done, there are several pharmacological things you can bring in. TRT, where you give testosterone in injection or pills, and there are other things, but there are other pills. Like, now, I don't naturally want people to go into all of these, except of course you have finished giving birth, you are in your late, let's say 50s downwards and you can afford to experiment with some of these things to boost your testosterone, I would prefer you stay natural and go with some of these natural things I've mentioned previously. The next problem is penis size. Men are worried about the size of their joystick. They usually feel it is too small, but for most people, they are within the average length and girth. Length is like this, girth is like this. But for most men, they are within the average range. And so you see them looking for several penile enlargement solutions, which most of them don't work, are just simply exaggerations or even outrightly dangerous to your health and can cause permanent damage or loss of your organ. And so there are many pills you take, there are creams you rub, there are pumps you use, there are what we call extenders that you put and you are stretching it. There are different methods like milking. The truth is that when it comes to the size of your penis, what you have is what you get, right? There's little or nothing you can do to change the size or even change it significantly. Whatever thing you hear that they say works, injecting fillers and all those stuff, are just either temporarily increase or they're even dangerous. And the increase is just tiny, few inches, may not even be noticeable. And then things like surgery, those ones are expensive and very dangerous. So as much as possible, just try to make good use of what you have, because it doesn't take size that much to achieve what you want to achieve, right? You can use a bazooka, right, or AK-47, or you can use a pistol and you can still achieve what you want to achieve, right? So you learn how to use your hands, your mouth, your tongue, and different things you can use based on your own convictions and what you're comfortable with and what both of you agreed upon. But generally, what satisfies especially the female partner is outside, right? So we talk about the clitoris and other things. They're actually outside. Learn to look for ways, alternative ways to satisfy your partner beside the glorified societal big size. And the truth is, it's all societal constructs don't matter when it comes to the replay in the other room. So consider burning fat, especially lower abdominal fat. It will increase the size because sometimes it gets buried in fat there in the pubic area, and then shaving and talking with your partner, communicating with your partner. What you have is sufficient. Trust me. Just learn how to use it. Improve your sex skills and you'll be fine. Number 5, porn addiction, where you get addicted to watching others have sexual intercourse. Watching videos or watching other persons physically or imaginations or images. It is very, very easy to access porn these days. In fact, there's soft porn on even our major social media like TikTok and Instagram. You don't even need to go to all those porn sites. There's some form of addiction that many men are suffering from, that they can't stop watching porn even when they don't need to, or they can't perform without watching porn. And this affects every aspect of the person's life. And in fact, there's what we call PIED, pornography induced erectile dysfunction, which is erectile dysfunction, weak erection you get due to addiction to porn and excessive masturbation. You can see some persons, even when it hurts, sometimes they're even sore with bruises, but they can't stop. And it affects everything when it comes to your sexual life. It affects your erectile dysfunction, it causes premature ejaculation, low libido, low desire, and you don't respond to your partner anymore. And the solution here is complex, but start by gradually reducing the amount of time you masturbate and watch porn. So if you do that daily, try to reduce it once in 2 days and then consider 1 in 3 days. So gradually reducing. Don't try to stop abruptly. You will fail. Just try to reduce gradually and try considering things like, if you watch porn and masturbate, consider masturbating without porn. That's progress, right? Consider touching yourself without watching. Also remove every signal and trigger. There are certain things that trigger you to watch porn and to masturbate. So it could be your social media handles, you follow your social media platform, you can consider deleting, unfollowing, using porn blockers, anything to avoid, even if it means when you are alone or stuff like that. So try to avoid triggers. Is it the group of friends? Is it the kind of chat you have? Is it the group you belong to? Just try to avoid triggers and signals. Hit it from from the root. If you don't have triggers and signals, if you don't allow triggers and signals, you won't fall eventually. And try to replace it. Get a hobby, get something to replace it. So if you discover that you usually do that when you go to have your bath, consider doing a lot of push-up and exercise till you are excessively weak to failure, and drop your phone, put off your phone in another room, and then go to the bathroom. Just generally try to avoid and replace it with something healthier. Consider talking to another person about it. It could be a partner, it could be a friend, so somebody you trust, a religious leader. Accountability matters, right? It helps. And if you keep focusing on the pain, how it is destroying your health, your sexual life, damages it's causing, and also looking at the gain, what you gain, the control, how you gain better sex life, control of your ejaculation, better sex drive, how it improve your general life, you see, it will help you to overcome. If it requires you working with a therapist, great, but just know that there are no pills you can take maybe physically to avoid porn, because I see some persons come and asking for pills. No. And if you go to askdrmalik.com/30, I have free resources for you there to help you to overcome everything, all of these problems in 30 days. So go to askdrmalik.com/30, and if you click here, I have collected a series of videos where I go in depth in some of these things I've mentioned, and it's free. So click here to watch for erectile dysfunction, premature ejaculation, to low libido, to porn addiction, to penile enlargement. Everything is on this playlist. Just click here now and watch it. Take charge of your health and happiness. Stay strong, and I'll see you in the next one.